Psychosocial integrity, psych nursing can be one area that will determine a pass and a fail. Let's master this concept. Video number 5. Let's solve these 10 questions. As usual, pause the video, answer the question on your own, and keep track of your record. Put it in the comment section. First question, how do you approach it? Read the question from the back so that you figure out what the nurse is asking or what you are supposed to do. They said, which catatonic feature is the client exhibiting? Therefore, any answer choice that you pick should be catatonic. That's the buzzword. The nurse is assessing the client who remains motionless in bed. During examination, the nurse gently lifts the client's arm and the client maintains the new position for several minutes without resistance or volunteering movement, right? That's no move. Wherever you put the patient, the hand stay there forever. What do you think is a catatonic feature? Which type of catatonic? Waxy flexibility, echopraxia, posturing, and stupor. What do you think? Pause the video. Let me know. The key fact is client maintain the new position several minutes without resistance or voluntary movement. That's no move it at all. You pick your answer. The right answer is waxy flexibility. This is positional movement where the individual basically maintain the position no matter what. Echopraxia is basically I'm copying your movement. If you move your left hand, I move my left hand. If you move the right hand, I move my right hand. So echopraxia is me copying your movement. So I'm imitating your movement. Posturing, basically bizarre movement. I put my neck a certain way and I kept it at the same place forever. It's different from you placing my head in that position and I keep it. So posturing and waxy flexibility are different. And the stupor, basically, you are not moving at all. Therefore, the right answer is 1. As usual, these are concepts the NCLEX want you to know. Nurse is caring for a client who states, you are the best nurse in the world, but the evening nurse is terrible. Which action is the most important for the nurse to take? Recommend different staff. Memo is assigned to the client each day. Maintain consistent communication and living setting among staff. Ask the client to explain complaints about the evening nurse. Reassure the client that the staff will try to improve care. Post the answer, question, and answer yourself. Let me know. But I can tell you, this patient is a borderline personality disorder. What is they doing? They're splitting. Answer choice should address the splitting. It should not address the borderline. The splitting is the problem. Therefore, consistent communication and living setting, because if you change the nurses, each individual nurse will be subjected to the splitting. So if you pick one, it's okay, but it's a wrong answer. It does not address the most important. The most important is to prevent the splitting. That means we are going to say the same thing, whether another person is seeing you. Asking the client to explain complaint does not address the splitting. Reassuring them is irrelevant. And then she's assessing a client with possible alcohol use disorder using the cage screening approach. Which question about the nurse require intervention by the charge nurse? The buzzword is cage. You have to know what cage is and what it constitutes in cage. Do you believe alcohol has ruined your life? Is that appropriate question? Have people annoying you by criticizing your drinking? Have you ever felt you should cut down on your drinking? Do you feel guilty about your drinking? All of this are what? Consistent with cage? Which one should the charge nurse intervene? That means one of the answer choice is not consistent with cage screening. You pick your answer? One of the answers feel good, but it's not right. That's what psychosocial integrity does to you. They give you feel good answers, but stick to your ground. Know the concept. For cage, what do you worry about? Cutting something. Do we see cut there? Oh, I'm cutting my drinking. You felt about it. Annoying by somebody annoying you about criticizing your drinking. Do you feel guilty about it? And do you need eye opener? That means you got to get it in the morning, otherwise you can't function it. Do you believe alcohol has ruined your life? It sounds good, it sounds personable, but yes, it does not address the cage. The nurse has reviewed the clinical data. Which personality disorder should the nurse suspect? Okay, who are you? Client has a history of repeated legal problem, bad problem, right? Frequently lies to others for personal gain. Oh my God. And shows what? Little remorse after hurting or exploiting people. You figure out buzzwords in the sentence. This is what the NCLEX will do. Give you the buzzword. You are not being deceived. It is what it is. If you overthink it, you'll lose it. Decline state, rules are for other people. What are they doing? They don't like rules. And they report getting into a fight and manipulating others to obtain money and favor. What do you think? All these things is consistent with what? Is he dependent, narcissistic, antisocial? What is it? Avoidant personality disorder. What do you think? Is antisocial personality disorder? It's not avoidant. Avoidant, they try to avoid. Narcissistic, they try to raise themselves above other. They don't break the rules personally. They think they're on top of you. Antisocial, they against society. Everything society norm, they break it. Dependent, they depend on you. Therefore, this is the right answer. And this is providing education about intimate partner violence. Which statement about intimate partner violence are accurate? Select and apply. Victims of IPV may minimize or deny their abuse. IPV occur only in marriage relationship. Pregnancy always protect. If you have a client from IPV, the nurse should interview the client privately when IPV is suspected. Victim may remain in abusive relationship for complex emotional or financial reason. What do you think? It's a common sense approach. You know about it. You've seen it before. Pick an answer. Don't over-select. Just pick those that you're 100% confident. They're going to deny, right? You're going to victim of the person who deny it. And what is the problem? IPV occur in early marriage relationship? No. Pregnancy always protects the client from IPV? No. The nurse should interview the client privately? Yes. Victim may remain in abusive relationship for complex emotional reason? Yes. These are what is accurate with consistent with intimate partner violence. These are very important. Remember, pregnancy is more likely to be abused, and it can occur both in relationship or whether you're married or not. So it can occur. And let's care for a male client with what? Early onset of Alzheimer's disease who accuses the nurse of what? Starving him by refusing to provide breakfast despite eating 20 minutes ago. I give you food, you eat, you have early onset of Alzheimer's. You say, you starving me. What is the next best response? What do you say? Offer the client meal as soon as possible. Give them food right away. Tell the client that the next meal is scheduled an hour since they are already eating. Well, you already eat, wait for an hour. But they are accusing you. Provide small meal next time and offer the rest of the meal when requested. Don't give them all the food. Just give them a little bit because they will come and say, hey, you never give me the food, and you give them extra one. Tell the client next time you will do better. Is that what you want to do? Alzheimer's, early onset, they don't remember that they've eaten at all. You can give them all the food they need, they won't remember. Therefore, which answer choice do you think is appropriate? The best one is piecemeal feeding. You give them a little bit, let them come back, and then we'll deal with it. Otherwise, they're going to accuse you. If you tell them they're already eating and then they have to wait an hour, they're already in front of you. They're saying you're accusing them, you're starving them. Yeah, that's not the right answer. This is the best one. And this is assisting with the group therapy for a client with alcohol dependence. You see, I focused on a bunch of alcohol questions because it's that I yield on the NCLEX that you need to know. It's everywhere. One client keep on interrupting the discussion. Why you keep on disturbing the meeting? Which action by the nurse is appropriate? You have to be therapeutic, but you have to be assertive, right? Ask the group about their opinion regarding the interruption. Ask the group to vote to expel the client. Ask the group about rescheduling the meeting due to interruption. Personally, ask the client politely to leave. This is a tricky one. Whatever answer choice you pick, if it's wrong, it's okay. But just know, be available next time, be confident about it, that, oh, these are a little bit that the NCLEX will trap you. What do you think is the most appropriate? I always say, when it comes to psychosocial, always do what? You pick your answer, put it down, and let me tell you. Always let the patient talk, not you. You know talking, patient talking. So which answer choice? The patient is talking. Personally, ask the client, you are talking. No one. Ask the group, fine. Ask the group, okay. Ask the group. So 3 of them are saying, ask the group. This one, you are the one talking. So ABC may be right. Which one is extreme? Expelling the client is not good. We got to find out why he's doing that. Rescheduling, we cannot find why the patient is doing that. Therefore, ask the group about their opinion. How did they feel about one of their members is interrupting them, preventing them from getting their care? This is how you answer therapeutic communication question. You go with the basis that, oh, you are not supposed to be talking. The patient's supposed to provide their emotional, their thinking for you. Psychosocial integrity. That's what it means. Psych nursing. And then listen to that. But when you're talking, you are the center of the attraction. No. And this is assessing a client with suspected alcohol dependence. Which assessment question would the nurse ask first? The same thing, cage. And you don't put cage there. But this is the buzzword. When you read the question, I'm leading you that you have to know that this is a cage question. Every time you see assessment of alcohol dependent, think about cage, right? Have you ever felt you should cut down on your drinking? How long have you been unable to control your alcohol abuse? Why do you continue drinking despite its harmful effect? Do you believe alcohol has ruined your life? For cage, what do you think? First question, cutting down. Then are you being annoyed? Do you feel guilty? Do you need a higher opener? All the others are feel good question. It does not answer the question. You have to understand the question and know that this is a cage question and then minimize it. This is why these questions are a little bit difficult. I intentionally studied that way to give you critical thinking that come out from the question that this is asking me about cage. There's going to be a feel good answers. Ignore it and keep on moving. This is also a thinking question. You got to put things together. A little bit of pharmacology. Client with a history of depression, one, and schizoaffective disorder present to the emergency room with right lower quadrant pain. It has nothing to do with the problem, right? He has right lower quadrant pain. Okay. Post-op in the PACU, patient surgery, client developed muscle rigidity, locked jaw, temperature 104, patients on fluoxetine and laxatine. What is the condition the client most likely experiencing? Neuroleptic Malignant Syndrome, serotonin syndrome, extrapyramidal syndrome, malignant hyperthermia. This question requires critical thinking. Go back to the question. I have depression. Am I taking the right medication? Fluoxetine, good. I have schizoaffective disorder. Am I taking the same medication? Lazepine. This is antipsychotic. I'm trying to answer this question and show you the trick. Now, after surgery, all of a sudden, I have what? Muscle rigidity, locked jaw, and temperature. Which condition is that? Pick your answer, let me know. You can't pick serotonin syndrome because what is the problem? Serotonin syndrome, you have to add extra thing to serotonin. Even though I take SSRI, I've not taken excessive serotonin. So that one is gone. Extrapyramidal syndrome is a movement disorder, not autonomic dysfunction. Therefore, this is gone. Don't pick it. EPS is not. Malignant hyperthermia is related to anesthesia, right? Good. But this is the key. The difference between them and neuroleptic malignant syndrome, the patient was on lazepine. He was taking antipsychotic. And therefore, this is responsible for that. No, malignant hyperthermia. This is how it presented. If the patient is not antipsychotic, and there will be some clue telling you malignant hyperthermia. Yeah, this is all consistent with that. And the last question. A spiral of a client with moderate Alzheimer's disease told the nurse, I am tired. I'm neglecting my own needs while caring for myself. What do you think? Be therapeutic, at the same time provide care for the parent or the caregiver. The nurse intervention is appropriate. Recommend respite care. Recommend family meeting to solicit help from other family members. Recommend institutionalization in a nursing home. Recommend referral for counseling to help cope with exhaustion. Assess the spouse insight about the difficulty in caring for the client and tell the spouse things will get better. What do you think? Right? Things are not going to get better. You got to know how the caregiver is feeling. Counseling is good. Institution is not good. We got to figure out what is going on. You need a respite care for the caregiver and somebody to come and help. This is NCLEX practice question, NCLEX practice test, Psychosocial Integrity Psych nursing. Did you get 10 out of 10? I hope so. If you get 7 out of 10, you're good. Anything less than 7, we got to watch more. These are 5 videos. help you master your concept. If you like video, just a small comment, just give me a heart and I'll give you a heart back so that this video can reach those who need it. And if you've not subscribed, subscribe for more content like that. Take care of yourself and good luck. Bye.